Hi, my name is Utah Lee. I am the founder and CEO of Accelerate Biosciences. And I'm here to tell you today about our human trophoblast stem cell platform. We are a complete stem cell platform company. Delaware C Corp, formed in 2013 in Philadelphia. We have complete freedom to operate over these human trophoblast stem cells. And my business model is to just provide a GMP TSCs packaged with all the right documentation so that we can out-license to cell and gene therapy developers to accelerate their therapies to market. One of the biggest problems that you have today with the industry is finding the right stem cell source. Ethical issues, inconsistent cell source, you have to choose between scalability and immunogenicity, and unclear FTO, and CMC documentation issues. We actually have solved all of these issues for you. Our cells are pluripotent, they're ethically sourced, scalable, naturally immune privileged, they're pathogen-free, have chromosomal stability up to high population doublings, and we have a gigantic IP estate to protect it too. So who's our competition? It's actually all the other cell types. We can work with anybody. So this is a continuum of where of fetal development and where all the stem cells currently come from. Our TSCs are sourced between 4 to 8 weeks post-fertilization, still in the embryonic stage, from ectopic pregnancies. Now these cells are mortal, so they do senesce, but they're pluripotent. On the left side here, you'll see a blastocyst at 5 days. And our cells are from the trophectoderm lineage, the ring on the outside. And in an ectopic pregnancy, what happens is the embryo travels down a fallopian tube and it gets stuck. And it'll continue to grow until it bursts the tube, right? And if it bursts the tube, the mother may die of internal bleeding. It's actually the highest cause of death in first trimester pregnancies. And so what happens is the mother will feel sharp pain all of a sudden, need to go into the ER, get scanned. The doctor will say, oops, you have a tubal ectopic pregnancy. So they have to schedule an emergency salpingectomy where they go in, they ablate both sides of the mass, and they use a scope to remove the mass, and they discard it as medical waste. And so how we discovered it was my father is a MD, PhD. He got his MD from Japan and his PhD from University of London, St. Bart's. And he was performing this salpingectomy procedure back in 2003, and he was thinking to himself, there's got to be amazing stuff in here. Why are we throwing it away? But to avoid all the ethical issues, we went after the preplacental tissue. That's how we came, that's how our cell line can be. So what we do is we stop the standard of care at the moment where they extract the mass, and we scrape off the chorionic villi. And we return the mass to the surgeon, who gives it to the pathologist to confirm, yes, it is an ectopic, and they still discard it. So these chorionic villi are technically supposed to be waste material, but this is where we get our cells. And this actually occurs at 2% of pregnancies worldwide, so we can get them anywhere. So we have clear ethical clearance. Our cells are pluripotent. We can differentiate them to all three lineages. And we're working with a lot of different institutions for this program. So for example, for red blood cells, we're working with an institute in the Netherlands. With ectoderm, we are differentiating ourselves to neuroprogenitors and working with National Taiwan University on a Parkinson's program. And with endoderm, we are working with A-Star in Singapore for T1D. Now, we don't intend to take any of these directly to the clinic, so what we want to do is just have them as proof of concept, package up all the data, and out-license it to you nice folks. We're also looking into the exosomes, and we're working with the NIH to characterize the exosomes for cell senescence and anti-aging. We were able to in-license an mRNA technique to turn our cells into an iPSC as well. And we're working with a couple of companies now to out-license to turn into kidney cells to produce AAVs or differentiate them to RPEs for ocular disease. So there's a lot of different ways you can work with our cells. We can push our cells out to 85 population doublings. So that's 100 million cells per dose. That's 8 times 10 to the 17 doses. That's more cells than you'd ever need in a product cycle. And imagine the effect that it will have on your cost per dose, using it as an allogeneic cell source. Our cells also naturally express HLA-G. Now, the embryo is a recombination of the father and the mother's genes. So how come it's able to attach itself in the mother's endometrium without her immune system going crazy and rejecting it, right? Turns out HLA-G is the main marker that prevents that. HLA-G is also the main marker that will allow you to now take that same embryo and implant it in a surrogate mother to carry your baby to term. Pretty incredible. And when we differentiate our cells to neuroprogenitors and pancreatic progenitors, the HLA-G sticks. That means our cells are really ideal for therapeutics. We put them in 5 different animal studies in immune-competent rats, and what we see is survival of these human cells in these rats. They home and regenerate. We don't see any teratoma or tumor formations, and we get all the behavioral improvements as well. When we did the expansion, we did the Carostat last at 72 population doublings. They're super, super stable. And we believe the reasoning is because these cells have been incubated in the fallopian tube. So it's never traveled down to the uterus, been affected epigenetically by the chaotic microenvironment of having to go through birth or becoming an adult. So they're going to be super early, very stable pre-implantation cells. We currently sourced 13 different GMP-compliant cells, all from Taiwan. And in Taiwan, a third of the women will have HBV, and more than 90% will have CMV. Now, according to the FDA, we have to throw the cells away, and we do. But before I did, what I did was I sent these cells over to IDEXX and did the H-Impact-1 study for 25 human pathogens, and they come back completely negative. So that means that even though the mother has HBV or CMV, the cells are 100% clean. So there's a defensive mechanism at the fetal-maternal interface that we don't completely understand, and it's very hard to research, but it exists. Right? So these cells are super, super clean as a starting cell source. Our cells are adherent cells, so we did a small POC on microcarriers in suspension and high viability and high growth. So there's a lot more room to optimize here for your programs. As I said before, we took mRNA reprogramming method, non-integrating, and we turned our HTSCs into an iPSC. And we took a kit off the shelf and drove them to an NK cell and did a cytotoxicity study with them. And this is with K562 CD19 expressing cells. And they kill like gangbusters. And we believe that the reasoning is exactly the same as before. These are super early pre-implantation cells. They're going to be extremely lively and very, very active. We already have 47 patents to date. And the reason why you're only hearing from me this year is because we've been running a very contrarian strategy. We filed the first patent with Wilson Sonsini back in 2005, and one of the top lawyers sat me down in 2010 when I got my first composition patent, and he said, hey, listen, what you have here is really special because you sit right in between all of the immortal cells and a non-scalable MSCs. So a couple of pieces of advice: don't tell anybody you have this until the market's ready. And do not give any of your cells to researchers because they will publish and it'll be public. And if the schools are smart, they'll file patents. Next thing you know, Stanford's got a patent, Harvard's got a patent, and you have a thicket of patents above your head, and you will have to license them all back if you want to commercialize. And that's what we've done. So we kind of sat on it, and I started coming out and telling people about it only last year here at Mesa. And so now we have 47 patents. And so if you come work with us, you will have the protection of these patents and have freedom to operate over the cells. And all you have to do is stack your IP on top of ours, including differentiation protocols, for example. If you want to work with T cells, bring that to the table, and let's work together. We have a wonderful team. We all came out from Philadelphia. I'm here. Martina Mosbergen and Siko Popmar, CSO, is sitting out in our audience. We'll be outside after the presentation to exchange business cards. We have a great scientific advisory board. On the left, Jianan Li, MD PhD, is my father. He's a KOL for OBGYN in Taiwan, and he discovered this platform. Also, Mahendra Rao, former director of the NIH and founding director of the Regenerative Medicine Center at the NIH. Benjamin Fryer, ex-J&J, our CRO. So all this data that you see here today, with the exception of the animal studies, was optimized and done by Pluristics out in Seattle. Really, really wonderful group. And Peter Hudson and Bram Bout are product guys. And Bram Bout famously at Crucell developed the Percy 6 line for biomanufacturing. And he's now in our SAB and helping me take these HTSCs to make it into a biomanufacturing line. So we have 2 platforms on offer. Our TSCs, which we are taking to GMP by the end of the year, and we're working with Theragent. They're also here in the audience if you want to see them. We're wonderful CDMO. And we're working with Dark Horse Consulting to put together all the CMC documentation and file the DMF for us. And after that, we will then create an iPSC line, also under GMP. So if you're looking for a starting cell source, come talk to us. So we have perfect product market fit. We have all the right desired cell characteristics. We've de-risked the FTO and the CMC documentation issues. We can provide you with scale to reduce your individual dose cost and help you accelerate your product to market, and hopefully transform the current autologous service models to a allogeneic distribution model, and really just help cell and gene therapy become more affordable to all patients. Here's my information, so take a picture or scan, and I will also be outside to talk if you want to get in touch. That's it. Thank you very much.